Hello. People are Yes, I think we went on Instagram Live, Facebook Event Live, and Facebook Live all at the same time within like 1 second of each other. I'm seeing myself in three. Oh man, 3 different things here. This is crazy. Can we tilt them down just a little bit? All right, people, if you are watching us, we are talking about shoulder health, shoulder pain. That's what we're going to be talking about today. Why you have shoulder pain, what's actually the cause, the source of the shoulder pain, and then what to do about it. And Sarah, can we get one more thing up here to maybe tilt that? So that's what we're talking about. If you're here today on these things, the 411 and the 901, that's what we're going to talk about. Let's get that right there. Just bear with us for a second while we get all these little...
There's a lot of devices.
Drop
I'm working on it.
That works. And then, Jason, can you close those lines up there? Hey, we're all getting going here. So, 901 Physical Therapy. We are physical therapists. Come on, wait till that noise goes away. All right, yeah, this should be good. Got that. This is a little bit tilted. Good. All right, for everybody that's waving at us. Hello, everybody. Jennifer, Sarah, Jeff. Hello, everybody. Thank you for joining us. So, 901 Physical Therapy. We've been working together. We are an essential business, still in Memphis, treating patients. We're treating just a little bit. I say that because we're not social distancing. I understand that, y'all. Like, every time I see us on this camera, I'm like, damn, we are not social distancing. If that really bugs you, I totally get it. And just turn it off. That's fine. And you can send me a letter, and that's fine. Our goal here is to provide value to people during this time, which we know a lot of people, of course, pain doesn't rest. And so people are still in pain. And this is a good time for us as a clinic to kind of talk, and the different therapists here to kind of talk about something that we treat a lot. We've been having these workshops every Friday afternoon at 3 o'clock. This is our 4th, maybe, and today we're talking about the shoulder. Okay? So, again, I'm a physical therapist. My name is Dr. Clay.
Dr. Jessica.
Dr. Jonathan.
Dr. Sarah.
And we are going to do our best to speak up so you can hear us, because I know that the acoustics in this place is not great, and we don't have fun, cool little lapel mics.
We're working on it.
Someone was tasked with that. Oh well, that's good. All right, so we're here to talk about shoulder pain. What's going on, what's causing that pain, why you get it, and what to do about it. We're going to go through some of the anatomy, and we're going to show some practical exercises. So, my lovely wife, business partner, she is going to post on Facebook Live and this Facebook event if you're joining us. She is going to post in the comment section or just right below it on that page a link that if you click on that link, we will email you all of the exercises that we're going to go through today. If you're on Instagram Live, she will post, I think you click on our link on our page. I forget what you call that, whatever, but just go up into our page and it'll be like a little link on our page and it'll take you to the exercises. So, or if you're watching this and you're like, crap, I don't know how to do that either, then just comment and email me and I'll send you the exercises. Also, if you're joining us and you have questions about what we're talking about, please shoot them our way. Dr. Jessica here is monitoring all the comments. If you say nasty things or, she's not going to read that out. If you say, hey, look at that dude in the front with this cool logo, and this awesome lady with that cool logo, I said chick, I don't know how to say that, dude, chick, whatever. Then, we'll take that comment. Mom, Dad, if you're watching, hello. Gotta say that, my lovely wife. Don't give y'all a chance to say hello to y'all.
It's fine.
It's all about me. Play here's the world. All right, so let's get into shoulder health, because we probably had most of our viewers already stop watching. let's take a look. Let's talk first about why we see a lot of shoulder pain. And we're talking a lot mainly about pain in the front of the shoulder. There's lots of things that can cause pain. We're not talking about pain necessarily like if you've fallen off your bike and your like collarbone is sticking up. The stuff we're doing today is not going to talk about that. We're talking about pain that has come on. Maybe you had an injury a long time ago from lifting weights or lifting up a lot of things at home, whatever it might be, and you're having pain in the front of the shoulder. Maybe it goes into the arm zone. Maybe it comes back here. But a lot of times that pain that we see a lot, right, is that pain in the front of the shoulder. And it's kind of like this, I call it the Bermuda Triangle of shoulder pain because there's so many things that can cause pain. It's not as simple as, oh, it hurts right there, it's just my biceps tendon. Or it's just, it's always rotator cuff, or it's always the labrum, or whatever it might be. There's lots of different things that can cause shoulder pain, and we're going to talk about that. But the causes of shoulder pain, why we see it a lot, is because our shoulder has lots of movements. And if we are not moving well, or we don't have proper strength, then that can cause pain. So the three things that we're going to talk about today are needing, what's the flexibility or motion that I need that can cause shoulder pain if you don't have it? What's the strength that I need that can cause shoulder pain if you don't have it? And three, what is your posture, what are your mechanics like that can cause shoulder pain if it sucks? All right? So Sarah, if we're going to be talking about shoulder pain, and maybe we can use the anatomy here of our Dwight to talk about what are the areas of flexibility people need. The ball and socket, shoulder blade, what are those areas that everybody needs flexibility in that have to do with how your shoulder is working?
So the shoulder is really more of a complex, right? So it works together. So really when you have the shoulder is made up of both, there's the ball and the socket, right? So that's where basically the arm bone is coming up and it's sitting into the shoulder blade. You also have where the collarbone is coming in and meeting the sternum, and where the collarbone is coming in and meeting the shoulder blade. So that's the collarbone meeting the sternum, collarbone meeting the shoulder blade, ball and socket, and then also how the shoulder blade moves on the mid-back, right? So that's actually kind of considered a really important joint there as well. All four of those things have to have good mobility in order to be able to move. Particularly when you look at how the shoulder blade is moving, the thoracic spine has to be flexible. And this is where more often than not we get really, really stiff in that mid-back. And if that shoulder blade, basically, if I can't go into extension as I lift, right, and I stay in a rounded position, my shoulder gets stuck. It gets stuck. That's as far as I can take it right there. If I don't let that mid-back go into extension. Ooh, nice little shoulder lock.
So, like what Sarah's saying there is, if you have shoulder pain, y'all, it is not this simple. Let me just take a look at the ball and socket joint, right? We're not just looking at what happens right where that bone attaches to your shoulder blade. It's not that simple. You have to consider all of those other areas that she mentioned. Most commonly, like she said, it's that middle back. Am I in a slouch position a lot? And it's also how that shoulder blade is moving. So if those areas are tight, you can think about your shoulder all day long right here, but you have to deal with the other issues to really solve your problem. So something we talk a lot about with our patients and on social media and stuff is finding that root cause. Okay? A lot of times, again, people are seeing this and they say, oh, I've got pain right here. What's going on right here? And we say, yeah. I know that's where your pain is coming from, but the problem, the root cause, or what's driving that pain are the areas of tightness. For example, if I pull on my shirt right here, you'll see this is where the tight spot is, but I feel it tugging on my shirt up here, right? I feel it tugging my shoulder. I can go here and pull that all I want to try to loosen it up, but until I come down to the source and let go of that, then that tension is released, right? Hopefully that makes sense. It wasn't a stupid example.
That was a beautiful
Thank
one.
you, Sarah. So if I have pain in that shoulder, a lot of times that tension spot is back in the mid-back. And if I'm in that position and I keep trying to fix my shoulder, or I get an injection in my shoulder, medication, things that can. But if I don't go after and release the tension here, like Sarah showed, I mean, good luck in getting it fixed. I mean, it might feel better at first, or maybe no change at all, but it's not gonna really fix the root cause. And that's a big thing for us here at Mount Olive PT, is helping people understand what are those root causes, how do we go after those to fix the root problem, because our goal is to keep you guys active for a lifetime, and not just saying, hey, I've got to have to rely on an injection or medication or even surgery. We want you to be able to do those things that you're enjoying, stay active, and so to do that, you've got to go after those root causes. So looking at all those different joints are really key, and we're going to show you exercises, some flexibility exercises for each one of those things. Cool? Jonathan, what are some of the key areas of strength what are some of the areas that are most commonly weak, I should say, when they're seeing us for shoulder pain?
Typically, yes, enunciate.
Be loud, my friend.
Yes, sir.
Y'all like Clay, you're talking too loud.
So, kind of giving an example for like powerlifters or Olympic lifters, usually overhead, we want to have good strength with that overhead area. That's where we run into trouble. We may not be super flexible in that area. We may not be strong enough to maintain that shoulder in that overhead reach, which can cause a lot of trouble. Just like Sarah and Clay have been telling us, that shoulder joint has quite a few joints and quite a few mechanisms. So if you're weak in this area, there's a lot that can go wrong, a lot that can cause some issue that can travel down the chain.
And I think that's a good point, Jonathan, that when I'm in exercise classes, we spend a lot, when we press the weight up and we come right back down. We're not spending a lot of time always in the overhead position or working on strength. And so if we're not building or spending time building strength in those overhead positions, then that can be a big deficit. Or if you're doing pull-ups and all you're doing is trying to kip and then come up out of that position and then drop right into it and then come up. If you're not spending time really trying to develop some strength in those overhead positions, that can be a big issue.
And I think another area, particularly when we talk about muscle groups, when you go into that overhead motion, so press up again. So a lot of times when I see people immediately go into an overhead position, their elbow is turned in like that. So it affects the rotator cuff, right? So if anybody can guess one muscle group at the shoulder, it's generally the rotator cuff, right? But what does that rotator cuff do? We can strengthen all we want to down here. I can give you 500 different banded exercises for down here. But unless you learn how to utilize some of that rotation into that overhead range, you're going to have lifting and pressing overhead. So it's part of that is strengthening the rotator cuff, but not necessarily just strengthening the rotator cuff down here. It's strengthening into that overhead range.
And that's true whether you're pressing dumbbells, kettlebells, barbells, or maybe you don't love doing that kind of stuff, and you just have pain. You're putting a dish up into a top cabinet. Or you're reaching to for me, I grab my 8-year-old son, I throw him up onto his bunk bed, and so maybe you're doing that with your kids.
Putting your luggage in an overhead bin. I mean, everybody needs that.
Not right now, but eventually.
Travel.
Yeah, or you've had people who are power washing or doing stuff up, you're cleaning in your house, but you're doing these overhead positions, and you're in those little funky positions. So key areas of strength: rotator cuff, building strength in those top positions, shoulder blade strength, right? This has a lot to do with both tightness and weakness, is that because we're in this forward position a lot, slouched over. So if you're watching us guys right now and you're doing this, don't do that. Sit up straight for a little bit, then get back to slouching. Slouching's not bad, just don't stay there, okay? Sit up a little bit, chill, do whatever, right? But if I'm in this position for a long time, my pec muscles are going to be tight, and my shoulder blades are going to be pulled forwards, and when they pull forwards and around, that's going to create this, what I'm going to call muscle memory of weakness, or muscle memory of inhibition is the term, where those muscles are turned off. And so those shoulder blade muscles are what you need. If I'm going to lift a kid, or weight, I'm going to do a push-up, pressure myself. If I don't have that shoulder blade strength, again, very, very important. So we say all this, right? So I know I need to strengthen those muscles, but those are things that have to be dealt with if you're having shoulder pain, and all you're thinking about is what's happening with my shoulder. Again, too many times you think that, hey, I've got like a rotator cuff tear, I have arthritis, and there's nothing I can do about it. Y'all, there's so many things you can do about it by addressing all these other areas. In fact, if someone comes and sees us and they have lots of pain, one of the first things we're going to do is start just working on shoulder blade motion, shoulder blade strengthening. So there's lots of stuff you can do. All right, that takes us into our third thing. So we have flexibility, strength, posture mechanics. Sarah already mentioned one. When you reach overhead, if you're in this turned, rotated in position, as opposed to being more neutral, then that is one thing we're going to see people start to get into. And that you might have all the strength and flexibility you need, but that position you're putting yourself in is not ideal and can cause pain. Jessica, what are some other positions that we're going to see with an overhead motion? And I'll get out of the way so you can demonstrate.
Yeah. So a lot of times with overhead athletes, one of the cues they frequently get is to push their head through. So we end up with people that have a limited amount of shoulder mobility, so they push their neck through, and that puts a lot of strain on the neck. We also get a lot of people who have a little bit too much extension through the spine. So through here, we have the ribs flared out, and you can have all the strength and stability of the shoulder blade and the shoulder girdle all you want, but if you don't have a good, stable foundation of stacking the ribs on top of the pelvis, it's not going to do you a whole lot of good. So positioning with that weight or whatever you're putting overhead and having a nice stable position to stack that onto is going to be key to kind of tie all of these things together.
Yeah, and I think that's something that doesn't always get mentioned, is that neck position that Jessica was talking about. Long story short, your lower neck has a lot of connection and influence and control over what happens in the shoulder. Because of the nerves that come out and supply power to your shoulder, how your shoulders will follow kind of what happens in the neck. And so if you're in this slouch position with your neck and you're trying to do a push-up, if you're in a slouch position and you're pulling away from the ground or overhead, that is going to, in essence, destabilize your shoulder, or it inhibits, it weakens. It doesn't provide the most optimal position and strength for your shoulder. So paying attention to your neck and your head position is so key. There's nothing wrong with finishing that motion overhead for those people who do barbell and CrossFit type things and getting that motion, but you don't want it to come from your neck so much. You need to have that flexibility in all the areas to get to that position. So pay attention to your neck. And as your neck goes, a lot of times so goes your shoulder. Okay, so other things to be thinking about, and this is just, I think everybody is aware of this, but let's just say it, forward shoulder posture, right? We just talked about the neck position, we talked about your back being too arched. If I'm in a forward shoulder position and I go to lift something up, whether it's a milk jug or a weight or a kid, right? If I'm in that position every single time, that is not going to be helpful if you're having shoulder pain, or particularly if it's heavyweight. Now, honestly, if I'm grabbing milk out of the kitchen, the refrigerator, I'm not thinking about lock my shoulder blade in, grab that milk, pull it. No. But I don't have any shoulder pain. Okay, so there's nothing wrong with reaching and grabbing something, reaching over to the side in your car and grabbing something. But if you're dealing with shoulder pain, or you want to avoid shoulder pain as you're lifting things that are heavier, you have to really be mindful of not allowing that shoulder to be in a dump forward position. It needs to be what I'm going to call a centered position. That's another question we get a lot from people, is do I need to fully retracting the shoulder blade or pulling that shoulder blade back and then move? No. A lot of times all you need to do is have my shoulder in a centered position, not in fully retracted. So I'm going to center my shoulder as I go to move, as I do different exercises. So again, we're just trying to paint a picture here, but there's lots of things to be thinking of. Flexibility of your collarbone, flexibility of the ball and socket joint, particularly with rotation, flexibility of your shoulder blade, flexibility of your mid-back, your ribs. You need strength of your rotator cuff, strength of your shoulder blade. You need strength in overhead positions if you're going to do. 3, you need to be thinking about your position of your neck, your back. All these things we need to do a deep dive in, if you will, to get to those root causes of shoulder pain. Cool?
And if you have shoulder pain, low back pain, and hip pain, you should really be thinking to yourself, thoracic spine, right? Because that is where all of those things come in and meet, right? So if you find yourself, man, I've had neck issues, I've had shoulder issues, and I've got low back issues, all of the commonality there is that mid-back, right? So everywhere you've got ribs, right? That's something that you probably need to really target.
Yeah. It's one of the first things we'll go after is flexibility. And again, we're going to show you some exercises here later, live session, and there's going to be, I mentioned before, just to mention again, there's going to be a link that my lovely wife is going to put on the Facebook event page. On the Facebook Live page that we're doing, there's going to be a link on that page itself or on our Facebook page. And if you're following us through Instagram Live, if you go to our page, there's a link in our main opening page. Well, I don't even know what it's called. I'm terrible at stuff. But follow the link on just click on our 9150 page. You'll find the link, and that will have. We'll be able to email you all of these exercises that we're going to go through. So utilize that. Plus, we always do, by the way, we do like a little say thank you for joining us. And if you have questions and you want to come see us or do a virtual evaluation, we provide a 50% discount on anybody who joins us on one of these workshops for just taking the time to listen to us. So you'll get a link to that special discount code as well. Cool? All right, let's talk about the anatomy just a little bit more. And we're going to talk about imaging, MRIs, X-rays, CT scans, that kind of thing, about what is appropriate, what is present, that kind of stuff. Let's get Dwight a little bit closer. All right. So this is anything that's in red and blue. It talks about where it's showing where muscles are inserting or where they attach. It's not about the blood. We get that why is this all red? We'll look at this guy. Okay. So quick review again what we've already talked about. Here is our shoulder blade, the scapula. This is the humerus. The ball is attaching into the socket. What this shows in kind of a crude way or very general way are all these ligaments that attach. It's called the capsule of the shoulder that attach onto the ball and keeps it attached into the socket. Then we have the collarbone, the clavicle, right? And then we have, of course, the thoracic spine. What we want to do, Sarah's going to talk us through the rotator cuff muscles, not the rotary cuff or the rotator cuff. It's cuff, rotator cuff muscles. There's 4 key rotator cuff muscles that are deep, that attach right to the shoulder blade, as well as looking at the muscles on top, the more superficial muscles, but how often we need to go after the deeper muscles to address pain, tightness, weakness, that kind of thing. So she's going to show you that, and then we'll talk about what you might find on X-rays, MRIs, and that kind of stuff.
All right. So here, make sure all views can see it. All views.
Views. It's all
yeah.
use.
All
use guys.
All use peoples. Yeah. So we have 4 muscles that make up the rotator cuff. So there's a muscle that, so if we look at just the shoulder blade here, right? So this is the shoulder blade, and you've got 3 muscles in the backside. So one that runs over the top part of the muscle, or top part of the shoulder blade right here. And then 2, there's one, and there's one, right? That run right underneath and on the lower part of the shoulder blade. If I turn around, there's also one that comes along the front side, right? It comes along the front side of the shoulder into the front side of the shoulder blade, so it kind of angles back underneath, so it's kind of like up under the armpit through there, right? So those make up the four rotator cuff muscles. These 2 muscles back here, they're your external rotators. So when we talk about the importance of having control over that external rotation as we go up into that overhead, it's really these muscles on the back side of the shoulder blade that you really have to target. Another couple important muscles that act at the shoulder, there's a muscle here called serratus anterior, okay? Serratus anterior is really, really important in a healthy shoulder. This muscle comes along the front aspect of the shoulder blade and then wraps along into your rib cage, right? So sometimes you see like the really ripped athlete or the model that has the...
You mean it's took the off?
Okay.
Sorry. Every time,
He
sorry.
keeps it interesting. But it's that fingery kind of looking muscle that comes around towards the front. What it does is it helps to move the shoulder blade on the thoracic spine so that ultimately as my shoulder goes up, it kind of moves forward and scoops on my back a little bit. If that scooping action doesn't happen, that's where a lot of times you'll get a little bit of irritation up closer to the joint.
Yeah, and that's a phrase that's called shoulder impingement. All right, let me see that after, Sarah.
Mm-hmm.
So the different things that we hear from patients are shoulder impingement. That's the diagnosis. So diagnosis is we hear. Bursitis, tendinitis, tendinosis, arthritis. You might have, they talk about the acromion, which is part of that tip of the shoulder blade, has some hook to it. rotator cuff tears, weightlifter shoulders as part of that impingement type thing. You get rotator cuff tears, you can get frozen shoulders, right? All of these things, guys, when we talked about all the different areas of strength and weakness and flex and position mechanics, all of those things have to be looked at really regardless of those diagnoses, okay? No matter what someone's coming and see us, we're going to look at how is your thoracic spine moving, all right? How is that serratus muscle working? Frozen shoulder, rotator cuff tear, no matter what. That leads me into the reasons why, because if you take, we talk about this with the low back and lots of different areas, a lot of people are coming in to see us who have arthritis in the shoulder, who have a partial tear of the rotator cuff muscle. So again, we're looking at these rotator cuffs, so maybe it's that infraspinatus, has got a little partial tear right there, or maybe it's the supraspinatus is a really common, has a partial tear. You hold this here. So meaning a partial tear is where the muscle's got, it's like maybe some of it's like this. It's not completely gone. It shows some of it has some lengthening or some tearing of those muscle tendon or the muscle fibers. Okay, so we get that a lot. If you take, and because they had an MRI of the shoulder or they had an X-ray and it showed on this ball and socket joint that maybe that where the ball is, that there's a little bit of arthritis, the joint might have some bone spurs or some thickening, those kinds of things. Be part of someone's pain, but if you just assume, hey, I've got a partial tear of my rotator cuff, or I have a labral tear, which is a deeper kind of ligamentous type thing in the shoulder, just because you have that doesn't mean that's causing your pain. Can you pull up the infraspinatus trigger point app to show the pain pattern of that? Because a lot of times muscles can cause pain, and it can cause that real deep ache in the shoulder, and it can be the muscle belly itself, not the tear. So if you take an MRI of 100 people's shoulder, they did one study, they did a study of 45 to 60 year olds, and they took an MRI and some scans of their shoulders, and they found that 70% of them had labral tearing, or partially, but the labrum was compromised in some fashion. And the way they kind of looked at it, it was between 60 and 72% had a labral problem, and these were people who had no symptoms, no pain, right? They did another study on active overhead athletes. I think it was on cricket athletes. But overhead athletes, these are athletes with no pain, and they did MRI, X-ray, CT, and they found, looking at tendons, bursa, bones, 90% of them had some type of positive finding. I mean, they had some problem on their MRI, their X-ray, saying that that's where your pain's coming from. But these people had no pain. All right, and these are in young, active, healthy shoulders. You're going to find other studies that show you pull 100 people off the street, and 30% of them are going to have some partial tearing of the rotator cuff, and maybe 50% of them are going to have some wear and tear of the tendon. So I say all that not to confuse you, but to help you understand that if you've been told you have a rotator cuff tear, then that might be the very cause, that thing that's causing pain. But a lot of times that just might be what we call wrinkles of the skin, or just kind of a normal aging process that can happen being active in your 20s, your 30s, your 40s. You don't have to be 80 years old to have, some wear and tear of the shoulder. Okay? So just because you have a tear doesn't mean that's causing all your pain, and there's so many things you can do about it to take the pain away. We have countless of our patients who have labral tears, partial rotator cuff tears, some arthritis in their shoulder, that when you address the shoulder blade, when you address the thoracic spine, when you address the rotator cuff strength in ways that are not painful, that person can get back to full lifting with their kids, they can throw, you can do so many things. So don't be hamstrung just because you have an X-ray or an MRI that says you have some type of some problem. Those are things that when you do a thorough assessment, you can really get into figuring things out. And I want to show you a picture of the pain pattern of the infraspinatus. Infraspinatus, again, is this rotator cuff muscle on the back side right here. We're going to zoom in right there. So hopefully y'all can see all that. That muscle right there, the one we already talked about with Sarah, if that muscle is tight, if it has knots in the muscle, people will come in, not saying they have pain necessarily in the back of their shoulder blade. If you look right here where the blue is, people are coming in and describing pain in the shoulder. All right, and they maybe say they have pain going down into their arm. Thank you, Sarah. And a lot of times, it's that infraspinatus muscle that's causing people to come in and tell us, man, I've got pain in the front of my shoulder. Right here, it's that deep pain, or kind of goes down a little bit. and they say, oh, it's got to be my biceps tendon, or I've got a rotator cuff tear, or I've got a labral tear. And we go back and we start messing around with this infraspinatus muscle, and we start working on it with some dry needling or some massage, and then we work on flexibility, and people are like, oh man, that's my pain. And the more we treat this back here, we can start to get rid of that pain. So so things like that are something that has to be addressed. And again, I'm going to show you an infraspinatus, that muscle, how to release that muscle yourself. Again, there's going to be a link that you can click to on the Facebook page and Instagram page as well. Okay? So let's go ahead and jump into that. We're going to finish with showing you guys some flexibility exercises, some strengthening exercises, and again, just touch a few points on form. All right. Sarah, do you want to grab the foam roll? So for flexibility exercises, we're going to show you first how to work on that thoracic spine. Like Sarah said, if you're coming in and you have shoulder pain, you also happen to have a history of neck pain or even back pain, go after your thoracic spine. Such a key area. This is one way to do it, using the foam roll. Just doing some thoracic extensions over that foam roll.
So you take the foam roll and you're going to put the foam roll anywhere, basically anywhere along the rib cage. Okay, so anywhere you have ribs. All right, so I'm not going all the way down to my low back. I'm not coming all the way up onto my neck. Right, I'm anywhere else on the spine, pretty much. Anywhere else you got ribs. What we're going to do is you're going to support your head here. I'm going to have one arm kind of out just so you can see me. You can kind of have your arms in. And what you're going to do is you're going to try to let the foam roll become a axis point. You want this to be kind of a fulcrum. So as I lean back, I'm leaning back, trying to keep everything below the foam roll still, okay? So I don't want to see a lot of movement in the lower
Make sure
back.
you're not arching your lower back, flaring those ribs.
I want to keep all of this still, so I'm kind of keeping my ribs pulled down and keeping my abs engaged there a little bit as I reach back and try to go into extension. I can kind of do that 3 or 4 times, and then I might move up and down a little bit. You might hear some pops and some clicks as you kind of get this area moving. That's a good thing, right? So you're just kind of creating movement along that thoracic spine.
Yeah, perfect. So again, you're going to get an email with a link that shows you that very exercise. So we're going to go through the other ones a little bit faster, but that's a really, really good one. That if you have shoulder pain, start with that foam roll. If you have a pool noodle at home, that works fine too. Different ways to work on flexibility of that thoracic spine. Another way we're just going to quickly show you is working on some flexibility of your shoulder muscles. Jessica is just demonstrating that position using a bench, but you can use a chair, a couch at home. But it's kind of like this kneeling lat stretch. Great exercise to work on getting your mid-back moving, getting your shoulder moving, lots of different ways. This one, of course, if you have shoulder pain that's really bad, reaching overhead, that's not going to be good for you. Don't start off with that. Start with the one that Sarah showed you. Okay? So those are some flexibility exercises that you can work on. Another one that I give people all the time, just as a starter, that if you have pain in your shoulder, is just working on what I call W's. I'm just getting my shoulders moving backwards and forwards. We're going to show you like using an exercise band with that, but just the flexibility in and of itself, going backwards and forwards, can help work on getting your shoulder blades moving to help start to decrease that pain. Briefly, I want to show you how to release that infraspinatus muscle. So we have 2 tennis balls stuck in a sock. I like to do this up against the wall a lot of times, where I put the tennis ball up against the wall and I kind of lean into it. But what you're doing again, y'all, is you're looking for those infraspinatus muscle back underneath the shoulder blade. Right there. This is where you're going to find that muscle. So you're going to put that tennis ball back here, and the video will explain it more thoroughly. But in essence, I call it a 3-step process. For 1, you're rolling back and forth. 2, you're going to kind of pause on that one spot and do some motions with the shoulder. 3, you're just going to sink into that muscle and just let it rest. And you're not trying to cause yourself a lot of pain, but if it's too much pain, put a pillow underneath it, make it softer. It should be like 4 out of 10 type pain, not 8 out of 10. You can also lay on your back, same kind of thing, putting that tennis ball back there, rolling around, doing different motions, and then relaxing. Okay? But doing a tennis ball, using a tennis ball, a cross ball, peanut, whatever you got to release that, very, very helpful. So that's our flexibility. flexibility of the rotator cuff, flexibility of the shoulder. This is kind of a ball and socket joint. It's a very simple one. Flexibility of the thoracic spine, and then flexibility in the overhead position. Now we want to show you some just rotator cuff strengthening exercises. You want to show them, Jessica? So what's we call the same thing, little W's, but it's shoulder external rotation. And this is very simple. You get a light resistance band to do this. If you go on our page, there's other ways of strengthening the rotator cuff, laying on your side, rotations. But the way to progress this, what Sarah was mentioning earlier, this is where you start. But if that's okay, you don't have any pain, we don't just lift down here, we lift overhead. So this is where we start, but then we need to take that strengthening of our muscles overhead. And so she's still working on engaging that rotator cuff by rotating first and then going ahead. I call it an H or a V. Make sure your arms aren't out to the side. She's looking good. We're keeping those elbows in. So that's a great way of strengthening the rotator cuff. And again, it's a lot of times people say, hey, I've done my exercises down here. Great. You got to take it up. There's another exercise called truck drivers and jumping jacks where you're, hold that band more, where you are facing the resistance and you pull out and then you go up again. This is fine, but I don't live down here with my shoulder. I live up here. And so I'm going to go up those positions, and then I'm kind of moving into this jumping jack position, right? So other ways to strengthen your rotator cuff muscles. Again, go in our, click on the link and you'll be able to get videos for all these things. Another one that we can show is working on shoulder blade motion. Our friend Britton Bailey has really helped teach us this one and emphasize the importance of that with panorama movement. And it's working with CARs, called controlled articular rotations on your hands and knees up against the wall. Excellent, excellent exercise. Y'all, if you have shoulder pain, please go look at that exercise. Please go look at this foam roll exercise. Please do these W's, right? Go nice and easy. If you have a little soreness, that's okay. If it's painful, stop. Give us a call if you have questions. But click on those links and you'll be able to find exercises that can help you now, even if you've been told you have arthritis and all that kind of stuff. These exercises are a good way to start getting things moving. All right, so that exercise, any ones I'm missing, Sarah, can you pull that list up? I just want to make sure we're getting it. There's so many things out there that you need to be strengthening your shoulder, but the things that we want to emphasize here is that you're working on a rotation-based flexibility and strengthening, and you're working on your shoulder blade flexibility and strengthening. You're working on your thoracic spine flexibility and strengthening. Now I remembered one of them. One way to work on the thoracic spine and your flexibility, laying on your stomach and doing these squeezes. We call them I's. You can go T's, Y's, and then we have what we call like a prone, reverse kind of snow angel type thing. But that exercise is great to work on the thoracic spine muscles and your shoulder blade muscles. So it's like I'm rushing through all this stuff, but the point is working on all of those things can help create healthy shoulders. So you don't have to just say, hey, I've got a problem, I'm just going to have to deal with it. No, there's so many things you can do to address that. Lastly, we're going to make sure of your positions. Really, really be mindful of your positions. When you reach overhead, don't arch the back. Keep those ribs tucked a little bit. Don't jack your neck forwards like this. If you're doing push-ups, don't let yourself slouch in this position while you're doing a lot of push-ups. It's okay to look up, but don't go into that slouched position. So those are the main things to be thinking of. Always be thinking about what are the flexibility issues I need, what are the strength issues that I need, and then lastly, what are the positions, the posture, the mechanics that I need to focus on. Focusing on where you are lacking in each one of those areas can really help get to those root causes of your shoulder pain and take care of it. Anybody got anything else to say? Y'all got to come back in. I'm not going to finish with just me looking here. It's like on The Office when they wave goodbye. And anyways. So, if you all have any questions, shoot them our way. Click on the link that Emily's going to put in the comment section and on the page so you can get access to these videos. Thank you all for joining us. Next week, we are going to talk about knee pain with squats, with running, whatever it might be. But that's going to be our topic next time. Thank you guys for joining us.